Months since D.C. passed a law to allow terminally ill patients to end their own lives, and not a single patient has been able to use it.
Frustrated patients are complaining that regulators have tied up doctors in bureaucratic knots. Bruce Leshan talked to one woman who's struggling to find a doctor to write her a prescription.
My name is Mary Klein, and I have terminal ovarian cancer.
After dozens of rounds of chemo,
I don't know how long I have to live.
Mary Klein has given up on treatment.
I would like to use medical aid in dying in the last days of my life.
Hands off, D.C. This 70-year-old artist and former journalist fought hard to pass D.C.'s Death with Dignity law, but now she is struggling to make it work.
So you can't get that prescription?
I can't get that prescription.
Klein had thought her doctors would help.
2 physicians who I thought were on board then said they were not.
The advocacy group Compassion and Choices says of the 11 people who have asked about medical aid in dying since D.C. legalized it just over a year ago, not a single one has been able to get a prescription.
And we have people calling us on a regular basis, expressing their frustration. It tells us that we have to do something different.
Advocates blame the D.C. Health Department's requirement that doctors fill out a form and register on the department's website before writing an end-of-life prescription. The health department calls it a streamlined process, but activists say no other jurisdiction that has approved medical aid in dying requires doctors to register beforehand.
I'm dying. I'm going to die of this cancer. It's not suicide. It's a cancer that's killing me.
And when the suffering becomes unbearable, she wants to be able to choose when to die, peacefully, at home, with her loved ones nearby. In D.C., Bruce Leshan, WUSA 9.
A health department spokesman says 2 doctors in the city have registered for the Death with Dignity program, but because of privacy rules, there's no way for Mary Klein to find out who they are.